work on this slowly. Because I know once like I said, you shouldn't feel anything other than us touching you, okay? Let's see if we can't. I don't think this is under your muscle, but I did forewarn him that's a possibility. But it felt pretty darn good to me. How long did you say you had this? Like 15 years?
Yeah, maybe more, but at least 15.
Everybody today has said 15, I feel like. You're doing just great, right? No problems?
So far, so good.
Okay, good. Let me lower him just a touch here. Sorry, guys. I'm always thinking I'm taller than I am. Good. Here again. Okay, I'm gonna do that little buzzing sound, so just make sure you're not touching metal under there. Okay. Buzzing. Can you hold this other edge out, please? Thank you. Just stops little baby blood vessels so that I can see real well. Take a good look at this lipoma. Let me see here. I'm just over the top of it. I can just see it now. Again, let me see. This edge here. Buzzing again. Everything looks good. Just slowly trying to make our way to it here. It's not very deep, but I'm always a little bit more conservative in the beginning just to see what we have going on. Everything looks good. This is a pretty small. This is like a facial one, huh? A medium one might work better, but let me just see. Does your brother know you came over here and you're doing this? Are you close that you told him? The one in Connecticut?
No. It's been busy, so have I.
I think I'm right over I think I see your little lipoma friend here. I'm just trying to see if I can get it out of a small little area here. So let's see if we can do that. Yeah, can you get the meat? Why would he use them? They're ours.
Those are his. Those are
Oh,
Rebushes.
wow.
He has this pair. He has a set now.
He has gold and we have silver. What?
Silver and black.
Why would we get silver and he have gold? Black is actually
what
good. I
happened.
think blacks are super cuts. Those are super sharp ones. All right, I see him. Let me see if I can't peel him off of you here.
Yeah, she has all sharp. She has all sharp ones, and then there's one rounded one. Else, please.
Yeah, they're like.
He likes the sharp ones, actually.
He does. Like, yeah.
I'm just tugging on you. If this hurts you, let me know, okay?
Okay.
Just pulling a little bit on you, seeing if I can't. Sometimes I'll just pop out. I'm hoping it will pop out and not stuck to you. Come on, little friend. Let's see if you can't pop out. Wouldn't that be cute if you did? Mm. Maybe, let's see. Come on, don't break on me. Come on, you cute little thing. I am a weirdo. I talk to them. Oh, he might pop out, maybe. Come on. You okay, huh?
Okay. Yep.
It doesn't hurt, right?
Not at all.
Okay, good.
And it's only weird if they talk back.
Yeah. They sometimes do talk back. They make little squinchy noises. It doesn't curse at me or anything, if that's what you mean. But, or maybe that is them cursing. It is that cursing at me.
God, you're a woman.
I don't know if he's gonna pop all the way out. I think if I just try to. So the characteristics of your lipoma is that it does look like it's its own entity, so that's good, but it tears easily. Sometimes so it makes it harder for me to like try to pull it out whole because it wants to just sort of kind of pull apart when I do that. So, come on. It's kind of, but not without a little bit of a fight and not without me getting it in little pieces a little bit. But it's coming. One of these times it'll just let loose, I'm sure. Come on. I feel like with the show, it's gonna end up being, I hope it doesn't end up being like more like the lipomas that are just difficult to remove. Because I feel like we got all the fun ones. We like took out in the world or something. Not saying yours aren't fun, but they got like harder to do. It's not me, is it? I'm not getting like harder for me to remove them. They're just getting harder to remove. Getting more complicated ones. I think we got spoiled in the beginning with those really nice ones that just popped out and we're like, oh, this is so great.
That's how they trapped you.
The lipomas trapped me, exactly. You okay?
Yep, I'm fine.
Okay. Alright, I know this is gonna pop out. I feel it. Let me just put a little paper break for a second. I'm gonna spill. I should go back and look back at like the ones, you know who I wanted to look back at? Like the one that, remember the Filipino guy that liked karaoke and he was singing Lionel Richie and stuff? Just to see if I made like a bigger incision or something. I don't know. I just decided to challenge myself and get smaller and smaller every time. Come here, come here. He's going the other way. Come on, pop out this way. Can you push not super firm, but not super hard, but a little bit? I'll help to push it out. I guess it just wants me to take it out in pieces. I think it is under a little bit of muscle here.
You're 2 for 2
2 for 2 what?
with the muscles.
Huh? Did I get, what do you mean?
What you said, you might think that they're on the muscle.
Oh, I don't remember. I don't even remember what we did
The
today.
last
So.
one.
I don't remember. I've already forgotten.
You told him he would be sore tonight.
Oh, yes, yes. Well, that wasn't really a lipoma, I don't think so. Something different. Whole different story there. Getting it. Sorry, you gotta hear my jabbering here, but I don't know what else to say.
All
I'm
good.
just trying to work on this slowly. Because I know it's almost like it's in too tight of a space, and once I loosen it up a bit, it might just pop out. Come this way. I know, look at her. She almost wanted to see how she wanted to help me.
Mhm.
She reached over. She's like, oh. Come on. So close. Do this, pup. Here he comes. I know he's so close, isn't he? So close. Come this way. Almost. How long did it take you to get your appointment? Was it pretty soon after we saw this? Somebody today was like, said she had to wait a year. I guess it just depends on what the
Oh, no,
is.
nothing like that. Maybe less than a month.
Okay, yeah, sometimes I'm sure we get some openings too and stuff, and we're trying to fill them. Okay, he's coming out, he's coming out. About this way. I'm gonna kill my hands today, I know it.
Have you seen those like post therapy like cold wraps when people are like mummied up and they're like in these,
Cryo?
the cryo, yeah.
Can you grab it? Here, let's see.
Shingles for her hands, just like big old gloves.
See if that pulls it out that way. Yeah.
It's supposed to have like soreness and like muscle fatigue.
It's just like carpal tunnel, like it's. Oh, I mean cryo, like cryotherapy, where they put themselves in like the ice boxes.
Yeah, but you need gloves
Oh,
after.
sounds terrible.
It's cold. You don't like to be cold?
I don't know. I don't know if it'll help me. I don't know. I guess anything will help. It's because it's, the skin on the back is like the thickest skin on the body, so it's under there, and so it's like I'm trying to get it out of a smaller hole. When it's under there, I have to kind of reach for it and stuff. So just taking a little more time. You can take that off. Let me just see if I'll squeeze it out this time. Yay! Something's happening good. I think we got most of it there.
He did not want to leave.
But Oi, he's about to be evicted.
I've been camping out for 15 years. Almost drive.
That was good, actually. That was very satisfying at the end there. That's the bottom of it. All right. Ooh, see? It talked to us. Did you hear that?
Yep.
I think he was a little angry.
Yeah, because it just got mad at us. I'm just feeling around now to make sure I got it all. See?
He's mad.
Oh, did you see that? He just like did a raspberry at us. Look what space it took up right there.
Mhm.
Yeah, I could feel that like going in, like getting less tight as you were moving it.
Oh, really? Really? I just want to make sure this other side is not lipoma. I don't think it is. But sometimes when we put numbing in there, it swells it unnecessarily. And so I want to make sure, taking out the lipoma. Sometimes it starts to like kind of wind around in other areas, you know, and I don't want to take out other fat. So here, well, in the meantime, just hold a little pressure on there, and I'm going to move this to give it a little time to look away. And
Thank you.
because see how that fat looks different too? It's like a little more orangish. Yeah, you can see where it was. Huh? But you can see that the other fat that's not part of it, it looks a little different. If lipomas could talk, that's what it would say. So I'm gonna have her give you a little binder, kind of to keep this kind of snug in your chest. Because you're driving home, you know, it's got a little bit of a distance to it, so it'll keep it kind of snug. Because it's most important to have like sort of a pressure dressing or a binder dressing in the first evening of this, because when the numbing wears off, there's actually a little bit of a medicine here called epinephrine that helps to constrict the blood vessels temporarily. And when that wears off, maybe it can bleed. I mean, this wasn't bleeding anything excessively, so I'm not super worried, but you know, just in case you move fast or do something, you know, it'll slow you down from making any quick movements, and it'll help to keep it compressed. And you can take that off tomorrow. Same thing.
In the morning or 24 hours?
If you can leave it on for 24 hours, that's great. But at least in the, you know, probably like, I don't know, probably like, and then also it's not harmful. In fact, it might be helpful, especially if you're a real active person, to when you're going about your business before you have the sutures come out, which will probably be in about 10 days. You have the binder on there because it keeps it snug in case you try to do something quick, you know.
Okay.
Say you just trip over something and you have a quick movement out and you're gonna pull the suture loose. Keeps it supports it. So next week I'm working on Monday, is that correct?
Yes.
Okay. So I'll just touch base and make sure that you
Just
guys know about
suppose.
Wednesday, that, you know, Jeff is seeing that patient. That's important we get that stuff over there, okay?
Not done popping? Check out this next video or check out my all access membership page to watch more videos.